We're so glad to be here with the champions for women and for the champion of women in health care. We want to acknowledge Marsha Greenberg from the National Women's Law Center, Eleanor Hinton Hoyt, the president of the Black Women's Health Imperative, Dr. Gerald Joseph, president of the American College of Obstetricians, and Nancy Radisson, the president of the National Council of Jewish Women. As you can see, I'm joined by a significant number of the women of the Senate. We are representative of the women of the Senate who really want to see reform in health care. Health care is a woman's issue. Health care reform is a must-do woman's issue. And health insurance reform is a must-change women's issue. When it comes to health insurance, women are discriminated against. We pay more and we get less. Often we are denied care because of the punitive practices of health insurance companies defining in a very narrow way pre-existing conditions. And there seems to be little awareness about our advocacy and the need for preventive and wellness initiatives. So we are here today to call for change in our healthcare system. When it comes to health insurance, we women pay more and get less. A 25-year-old woman is charged up to 45% more than a 25-year-old man. And when she reaches 40, it's up to 48% more. We get less because of these punitive practices. Women are denied coverage because of a pre-existing condition. Now, what does that mean? Well, it could mean that you had a baby with a C-section, or it could mean in some companies a victim of domestic violence where you denied health care because your husband was battered. Well, we don't believe in battered women, whether it's in their home or in the insurance marketplace. Coverage for women is often skimpy and spartan. Often health care doesn't cover basic women's health care, like maternity and OB services, or preventive care, like mammograms and cervical screening. We women are here to fight for change. For most women, of a woman of a certain age, we depend on Medicare. So we're here to say very loudly and clearly, we, the Democratic women, want to save Medicare and we want to strengthen Medicare. We want to end the punitive insurance company practices that discriminate on the basis of gender and pre-existing conditions. We want no more to annual lifetime caps that deny access. We women want cures. Our president was at the NIH today announcing money to be released for research. In a few weeks, women will be racing for the cure. But we want all women to be able to afford the cures that we invent in the United States of America. We want to close that donut hole that's been so hard to swallow. And we want equal insurance for equal premiums. A few months ago, we suited up and moved the Millie Ledbetter bill. We did make advances for equal pay for equal work. Now we're calling upon the women of America to suit up to get equal insurance for equal premiums. We're going to fight for that reform. So I'm saying to the women, once again, it's time to suit up, square your shoulders, put your lipstick on. We want the healthcare revolution reform.